Go ahead.
Okay, it's 1:30, so we'll begin the October 10th meeting of the Wright County Health and Human Services Board. And so we'll begin with the Pledge of Allegiance. I'm the new Mike Catchmark, so maybe the improved Mike?
I pledge allegiance to the flag of
of the United States of America, and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
And let's see, next is the minutes, and we'll dispense with the reading. Is there approval as written, or are there some changes?
I'll make the motion to approve the minutes, Madam Chair.
There was a motion to approve the minutes, let's see, from, 9/12. And the motion was made by Commissioner Hewsome and second by Commissioner Vetch. All in favor of that? Oh, is there any discussion? Seeing none, all in approval, say aye. And I'm sorry, I'm kind of out of practice here. It's been a while. And then those opposed, same sign. Okay, the minutes have been approved. Now we review and approval of the agenda. Are there any changes or additions there?
Madam Chair, I'll make a motion to approve the agenda as presented.
Second.
Okay, there was a motion to accept the agenda as written. And it was made by Commissioner Vetch and second by Commissioner Hewsome. All in favor of that motion, say aye.
Aye.
Disapproved? Okay. Now we have the consent agenda.
Madam Chair, I'll make a motion to approve today's consent agenda.
I'll second that.
Okay, there was a motion to accept the consent agenda made by Commissioner Vetch and second by Commissioner Hewsome. All in favor of that motion, say aye.
Aye.
Against, same sign. All right, the consent agenda has been approved. Now on to the regular agenda. There's a staffing announcement, new hire.
Yes, thank you, Madam Chairman.
Same
We do have
problem.
3 new staff to introduce to you today. The first staff, and if she would please stand, we have Trisana. She goes by Sonia Okerman. She's a new eligibility specialist with our Family and Adults Benefits team, known as the FAB team. And she started with us on August 15th, and she's been doing great. We've met already for our new worker orientation, and this is Sonia. Anything to ask Sonia?
Well, yes, since Commissioner Delyden isn't here to ask these questions. Well, welcome, first of all, and where did you come from, and from your past experience, or?
So before I came here, I worked at Anderson Trucking for 6 years.
Okay, good. And do you live in the area, or?
Big Lake.
Okay, good. Well, welcome to Wright County.
The Wright County.
The Wright County.
Forgot
Wright
that.
County.
That's
We're about, I'm sure Kim is here, and she's smiling ear to ear because, as you know, we've lost quite a few eligibility staff, and we are rebuilding at the time, at the
good.
moment. So we're really happy to have these folks on board.
Yeah.
Thank you. We have Caitlin Prestige, and she's our Office Tech 2 with our same team, Family and Adults Benefit team, reports to Michelle. And I don't remember, Caitlin, do you go by Caitlin? Or okay, so Caitlin, she started with us on September 1st. So welcome, Caitlin.
Welcome.
same questions for you.
I was HR admin for Marketing Technologies, and I live in Big Lake.
Oh,
Oh, okay, and then do you live in the Wright County?
yes, live and work.
Thank you, Caitlin.
Welcome.
Yes, okay.
And finally, in our newest edition, we have Thur Yang, and Thur is a new social worker in our waiver and community supports team. He reports to Leanne Thamel, and he started just on October 3rd, so welcome, Thur. Same questions.
Yes.
Same questions. Third game. Used to work with Phoenix residents in the Southeast Metro. Worked in the group home settings for about 12 or so years before becoming a case manager, contracted case manager, and now I'm here. Right now.
And where do you live?
I live in Brooklyn Park.
Okay.
I hope you're considering moving to the Wright County.
I'll have to debate that.
Okay, well, welcome all you new
Yeah,
employees. Very welcome.
Great to have you aboard.
Thank you, Board.
Now for the employee of the month for November. Okay.
Yes, and I've asked Jana to join me at the podium.
Nothing to be nervous about.
She has her song memorized, so.
Yeah.
Or did I fail to mention the singing? Oh, kidding. Come on up, Jana. This is Jana Hoganson. She's our November Employee of the Month. Jana started her work in Wright County in February of 2020, conducting child protection investigations. So she basically got her feet wet right away because that's a challenging area. In February this year, Jana moved to the rapid response position and has collaborated with several workers to create safety, strengthen families, and build stronger communities. Jana brings vast knowledge of community programs and resources along with a genuine drive to help families succeed. Jana's nominator states, Jana has been part of the intake and intervention team since March of 2022, so either I have my date wrong up on top, says February, working as a rapid response facilitator. She has really embraced her new role on the I&I team and has been such a great addition. She has been enthusiastic about learning the duties of both child protection intake and general intake, in addition to her own job duties to assist with coverage when needed. Jana is always willing to help others on the team and does it with a smile and lots of humor. Jana is always respectful when speaking with clients and their support people when setting up rapid response meetings. She is willing to take the time to explain the process and work through any questions or concerns they have. She works hard to make families comfortable with the process, and so they are more willing to engage in the process. Thank you, Jana, and congratulations on being our HHS November Employee of the Month. And Board, just for information, our rapid response, and I'm sure Jana could explain it better than I can, but it's a very, I would say, kind of thought-forward process in which we bring, when we have a child protection situation, and the family obviously is facing multiple challenges, we try to bring members of their family along with any kind of support people in the community alongside them to work through some of the challenges. And again, I think one of the goals is to avoid an out-of-home placement, to make sure that the family has supports, and that the children are safe and cared for. Would that be accurate?
Yes.
Okay, so
Yeah.
that's kind of a very important and vital role. And again, she's kind of intersecting with the public when it's probably one of the more challenging times of their lives. So she does a fantastic job.
Yeah, well, thank you for that.
Yeah, thank you,
Really
Jana.
appreciate that model, to be proactive and reduce some of the out-of-home placement.
She's also on our Spark team, and she I was one of the 3 apple tasting judges, apple baking tasting judges this past month. So she also has kind of a lighter side to her duties sometimes as well. So thank you for that as well, Jana.
Well, thank you.
Thank you.
And thank you, Jana, because the sense of humor in that type of job is very difficult. My daughter is a lawyer in that area, so I understand what you're going through.
I've been on the other side of some of emails and some conversations with some of Jana's clients over the last couple of years. And yeah, she deals with a lot, and she does it very diplomatically and very, very well. Thanks, Jana.
Thank you. Thank you again.
Thank you.
Okay, now for the social services, public health, and financial services. And we're going to accept a resolution, 22-6, for a September donation. Did you want to read that? Or do you want me to read it?
Well, I would say we could probably set aside the reading. I think typically we wouldn't read it, but we want to,
No.
I should probably
Well,
acknowledge
we could do the therefore.
the therefore. Yeah, I can do that if you would like.
Yes.
And this is an acknowledgement of the $2,500 that a cash donation from,
Right, Hennepin.
Right, yep.
for our special needs fund from Wright Hennepin Electric Trust. And now therefore be it resolved by the Wright County Health and Human Services Board as follows. The donations described herewith are accepted and shall be used as allowed by law. The Wright County Health and Human Services Agency is hereby directed to acknowledge to each donor the county's acceptance of the donation.
Madam Chair, I'll make a motion to accept the resolution for the donation,
I'll
the
second
September
that.
donations.
Second that?
You seconded?
Yes.
Okay, I'm sorry. There was a motion to accept the donation of $2,500. And that, let's see. And to the Health and Human Services Office. And motion was made by Commissioner Vetch and seconded by Commissioner Hewsome. All in favor of that motion, or if
Roll
there's
call-
any
roll call
discussion?
vote.
Oh,
Madam
it's
Chair.
a roll call vote, yes.
Aye.
Aye.
Aye. So the motion is passed,
Thank you, Board.
Yeah, that's,
or I should, the resolution.
Resolution.
and thank you, Wright Hennepin.
Yes. We will be sending them off a letter of thanks as well.
Thank you. Okay. And next is the environmental health update from Sarah Groshans.
Thank you. And Sarah's going to be presenting just some, I would say, information that we have. As you know, we've kind of been working through this environmental health area along with planning and zoning for the last few months. And so we just thought it would be a good time for Sarah to come back with kind of where we're at this point and kind of what our next steps are.
Thank you, and I'll be brief. We have moved forward with some consultation with HR and have posted a health promotion coordinator position. That's what we budgeted at for the environmental health position. I know we had some, I think we were calling them environmental health inspector, environmental health
Specialists.
but we moved forward with a health promotion coordinator. It's a job description we already have, and we had someone working in that role. Obviously, Anna did part of her job, but this person would be solely focused on environmental health. So that position is posted, it closes Friday. We have Ranjana on board, which you met last board meeting. And then we have quickly been delving into our water testing that we took up from planning and zoning. Everyone still, just in case, I know these are on televised to the public, they still get their water tests through planning and zoning. None of that has changed for the public at this moment, but we are going through a process. The lab is not certified. And so that is something that we have worked through with, and never has been, just to be clear. It's not a process we've gone through.
It's one of these things where we kind of, when we start looking at it, we kind of start uncovering, unpeeling the onion a little bit, and we're finding out some things that we had in place or thought we had in place that maybe weren't quite all the way in place.
Certified by the state?
Correct, yes. It is yes. So we're working through a process of determining kind of basically a cost-benefit analysis of certifying that lab or not certifying it, and then what that would cost and the maintenance of a certified lab versus contracting some things out, because some of the services that we need water testing for do require a certified lab in human services. So we're working through a process of figuring out how that will look. And we will present that to you over the next.
I think our goal is to keep it in-house if we can, and follow
Yeah.
all what the state needs us to be doing.
Yeah. In fact, just last week I was assisting Ranjana and reaching out. We have some really great contacts through other counties that have environmental health programming, and there's actually a significant, I would say about a good third of the certified labs in the state are run by local government, either through the city or through a county, and they offer support to multiple cities and counties, so it's not unheard of. And there is, just to be clear, there is no certified private lab in Wright County. So it's not, if that were, even if we provided a limited range of services, we're not competing with a business. So, and I'm assuming they do that because it's difficult to provide that resource in their area, which it is for us as well. Right now, we're offering that service, and planning and zoning has for years, for $25. A certified lab test at our most closest facility is it $85, $83. So we're talking about a significant price difference for individuals, even if it's what we're offering as a screening. So,
And board, just for your awareness, because I know in one of the next county board meetings, the county fee schedule will be revisited, so one of the things that I'm suggesting is that we set that $25 fee under HHS now, since it wouldn't, be on our staff doing it versus planning and zoning. But my other piece of it would be to then, what's the word, that we would waive that cost to our foster care homes and relative caretaker homes. So it wouldn't, as you know, we're already having a difficult time finding foster care homes and placements for kids, so we don't want that to be a barrier.
So with that, are we only testing private wells then, I'm assuming?
Correct.
We don't test municipal water.
no.
I didn't think so, but I wanted to make sure I asked.
No, and that's a different panel. I mean, we're only testing chloroform, so the presence or absence of bacteria. We're not even typing the bacteria, and nitrates, and then a relative value to the nitrates.
So basically what this test is, if it comes back as conclusive, we would then direct you to go to an actual lab testing is what we're kind of making this. This is kind of like a pre-vet.
You're exactly right. So most of the time they screen negative and everything's fine, and then, they can proceed. And some people do use the resource because they're concerned about their water, but the vast majority of our folks are in-house, either for licensing for childcare facilities or licensing for foster care.
And would this be through the Department of Health then? Or is it a special environmental department?
Are you talking about the licensing?
Yeah, the certifying.
The certifying is through the Department of Health.
Okay.
So Madam Chair, because when we went into this environmental health, we kind of looked at a lot of different things that we could get delegated authority from the state. And this is kind of the only ones that everything else we said with the cost benefit analysis at this time didn't make sense. Is that true?
We haven't actually done that piece with let me take that back. We have not asked the restaurant owners. That's the other piece that we're still looking at for delegates.
Because the biggest thing I'm looking at it from like a water testing, when you get into it, when you take on that other delegated authority and you're managing hot tubs and pools.
Correct.
With the other side of it, that makes it maybe more of an appetite to have actual lab testing versus where.
Yes.
That's the reason I didn't know.
I
where
see what
that
you're
piece-
saying.
Yeah, and I didn't know where that portion, because whether we were going to do just pools regulations, because I think you can segregate doing just one, or I don't know if you have to do food and pools.
You have to do the whole kit and caboodle. The only thing that you can segregate off from that is campgrounds and mobile home parks. That's a different delegation agreement. But yes, you are correct. So there may be more cost-benefit analysis or a different cost-benefit analysis about a certified lab if we were the delegated authority. And you're on our short list of folks to reach out to, Commissioner Vetch, outside. We can do this outside of the meeting, just because I know you had mentioned hearing from some folks. Now that we have staff coming on board, we're ready to do that outreach. What we had heard from the small group, Commissioner Wetter, you were part of that, was that they really wanted us to hear from operators in the community about the service that they're receiving, or and how it's going with their licensing. And I know you had mentioned hearing from some folks that wanted the county to take it on. We have some counties that do provide it that neighbor us. Stearns is a big example. Hennepin is another. And if those are, if they operate in multiple counties, they may have a different experience being able to weigh one or the other. And we'd like to have that feedback before we bring any proposal. I don't want to do anything without talking to our business owners. So,
Sarah, is one of the requirement too is, I know you talked about the health promotion.
coordinator, that's the job
Coordinator.
position, yes?
Would that person also have to be like certified in laboratory stuff, or don't?
No, it's about the lab. So
Okay,
you
it's all
can
about the
train the
lab.
individual. Yeah.
Okay, so you don't need a
No, it's likely our processes and and the training, or we may need to demonstrate a certification process, but the job description should be sufficient.
So we worked with HR in looking at how the job description was written now, and kind of what we all came to the conclusion that based on how the job description is written now, we can fold in, this position as well. So I think it's kind of along the county's lines too, of not adding additional job descriptions and, job types out there. So,
Well, in my background as a medical technologist, and I know when we were in our dairy operation, they had the lab up that's here in Buffalo that would do certain milk testing. And I was just wondering, because they usually needed to be actually somebody that was trained as a lab technologist or specialist. So that's why I was asking that question.
Yeah, and I think that's a really valuable point. So we actually also have a public health task force member who works in the infectious disease lab for MDH, but she lives in Buffalo.
Okay.
And we just had our public health task force meeting this morning, and she was also commenting. There's a big difference between those biological samples and the kind of resource or elemental, like soil, water kind of samples. They just don't come with the same risk factors, right? So even with milk, because it's coming from an animal, you have to be concerned about contamination and cross-contamination, all sorts of things.
Well, you would think that with water too.
Well, we do spend a lot of time educating people how to take a clean sample,
Yeah.
but there's less
Run
of a
it for-
concern about it, like spoiling, for instance, and some of those things. So, I mean, it's timely. There are some similarities. There's less of a concern for it making the person who's processing the sample ill, for instance.
Oh, okay.
Like, you're not worried about bloodborne pathogens like you might be with some animal or human samples. Not milk, but other ones. I digress. So that's really where we're at with those processes. We'll be reaching out, as I mentioned, and we may probably, don't be surprised if we reach out to each of you. If you have operators, so food or hotel operators that you think we should talk with, we're trying to figure out the best way to reach folks. I don't really want to send an email to 400 people and say, take my survey. I don't know if that'll be the most we won't get a lot of responses, is kind of my thought. So it might be that we do some, phone calls and go talk to people where they're at. So,
Are there any more
Sarah, there might be
questions?
some, like organizations to go through
and we
as
can go to
well.
chambers. Yep, we're working on that whole plan. So,
And board, recall that this is an area that we're going to have our public health AmeriCorps person work in. So I think that's kind of really nice in the sense that it's a additional person to do this work, and that then we can be informed and learn through that whole process. So by the time their stint is over, we'll own that body of work that's being done.
Were there any other questions from the board? Well,
I guess
same,
maybe I'll catch it offline as I'm trying to figure out what the food license split is, because if you
Yeah.
take it on, I'm sure the state is still taking some of their license fee, but you're just taking on a large amount of the work. So how much is the state keeping of those licenses?
good point.
we do all the licensing. And
So, but do we get to keep the $500 licensing fee on an establishment? Are we? How much is the state gonna still take of that?
they don't.
They don't take any of it.
I
Okay.
don't believe so, but I will double check that. And I think it's probably, we can talk offline, because I haven't looked at that in a few months.
Okay.
But this is the part that we're going into, so also just be aware, like, if you have someone in your community, like, oh, the public health is taking over environmental, no, we're, as you know, just investigating, asking questions.
Is there any exemptions of any organizations? I mean, I know like school districts, they still have to have their state license, but they still have to have a USDA license as well. So are we doing that, or is that still a state one?
So anything through USDA, we aren't able to contract with. And currently, there are different legal opinions, but the Department of Agriculture is not doing new contracts. So any grocery stores,
Food packers, I'm guessing. Anything that has to have a HACCP plan.
HACCP plan.
Anything that
yep.
has a HACCP plan is going to be delegated to the state still. Which
Yep.
is, okay, that's another thing, because that's a big cost factor that I don't know that we would.
Yeah, and so the licensing list, and that's actually a whole different department. So when I talk about 400 licenses, that is the 400 that are done by MDH that are in food, pools, and lodging. It's not anybody who has prepackaged processing license. It's not any of our, like there's a state license for like, our pizza manufacturers that we have, and those things that are in the community, that's not on the table at this time.
Okay. I was hoping that was the case, that we wouldn't be having to take all of that piece, because doing that is a whole different.
It's not even potentially it would make, I guess maybe it would make sense. Some counties do that, but MDA has said that is not on the table.
We couldn't scale it enough at this point to go from here to that.
That would take a while.
Considering we haven't hired.
One
the
bite of
position
the
yet.
elephant at a time.
Well, my concern with that is trying to do that in being able to get the staff you need to be able to do
for
it, and
sure.
do it competently, and the risk factors that come in to play with taking on those organizations. Because if you have one thing that was missed by us, the liability is so great.
Yeah, no, that's not, was not even part of our environmental health conversation. MDA has been very adamant that they're not issuing any new agreements. In fact, I think there are only 8 localities that have MDA agreements, and they don't even have currently signed contracts, at least the last time I heard, which was probably over a month ago. So it's really not on the table at all. We didn't even investigate that. I've only worked with MDH. But again, whatever we would find out, we would bring back to the board. It would be part of a decision. I know that, I think we have the unique opportunity that we have licensed campgrounds within county holdings. So I know Mark Matthijs has had experience working with MDH. He's very happy with the service. So I think it's really about if there's a place to provide improvement, and move from there. But I would say if it's not broke.
Yeah.
So
Sounds good.
We've got plenty to do, right?
we do, yes, plenty to do.
Thank you, Sarah.
Okay, thanks, Sarah.
Thank you.
Okay, next is the Healthy Homes Program Overview by Patty Melisek and Kelsey Collier.
And we also have Chastity Jacobson with us as well. And I just thought that might be a nice tie-in with the environmental piece and then with our healthy homes piece. This might be an area of public health that the board isn't acutely aware of, since there's a lot of different programs.
Thank you.
But I think it's something to get the word out to the public, and this is a great program to kind of do that introduction to public health.
Okay, so what you guys are receiving is the brochure that we hand out to clients about our Healthy Homes program. On the front where it says Healthy Homes, it gives a brief description of what Healthy Homes is. So it is a voluntary service that offers free guidance and education on reducing environmental hazards in the home. We have trained staff members, Patty and Chastity, and we also have a PHN who is out on maternity leave right now, who works with the team. And they work with residents to help address potential areas of concern, such as mold, exposure to toxins, asthma triggers, indoor air pollution, lead, and other household-related health risks. On the back, it shows the 7 principles of a healthy home, and these, in the assessment that these ladies do, it addresses all of these areas, and then based off of the results of the assessment, they are able to give education to the clients and additional resources for them to use to make their home healthier. Healthy Homes does not have a budget or a funding source at this point, so it is very a lot of education and a lot of resource giving. We did receive a small mini CAMI grant earlier this year, which we use specifically. We have some cleaning kits that include like HEPA filter vacuums, a lot of different cleaning supplies, and then a small brochure that these ladies go out and use to educate them how to use the cleaning supplies, but they are specifically for people who have been diagnosed with a mental health a mental illness. What I have for you on the screen is on our public website. If you go to HHS, public health, and then environmental health, the Healthy Homes description is on our main webpage. And then if you click right here, this is where you can get the Healthy Homes referral. So you can refer, anybody can refer anyone. People can refer themselves. You can refer yourself, or you can refer others. But like I said, it is a voluntary program, so we don't just go into anyone's home if they don't want us to. Patty and Chaz are here to share a story with you that did make the Herald Journal newspaper. So I will let them take it away.
So if you do a referral for someone else, we will call both the person being referred and find out if they're interested in having a visit. And if they're not, then we also would call the referral source and say they've declined service. We did get a referral to a house or to an apartment in a fourplex, a basement apartment. And her primary concern was mold and pests. And so I talked to her on the phone in advance. We always, for renters, we always recommend this booklet from the Attorney General's office, which outlines their landlord's rights and their rights, as far as a lot of the people that are calling us want us to do something to get their landlord to fix something. And we have to make it very clear that we don't have any authority over their landlord. So anyway, when I was talking to the woman on the phone, she was, going into detail about what was going on in her apartment. And I told her that it would be helpful if she went and got a sticky trap or some two-sided tape or something like that too. She was talking about insects, and I said it would be helpful if you could trap one so I could ID it appropriately. So when I got there, Chastity was with me on this visit, and she went over to a counter like this and pulled out a drawer. And she had taken duct tape and made little sticky side up things, and they were just full of German cockroaches, and some were dead and some were alive, and there was all different sizes. So she had a definite full-born infestation. So then we started to do the other 7 principles, and she did have staining indicating mold in her bathroom. Her kitchen had no exhaust fan, not even the kind that has a filter that, just filters it and puts it back in the room. There was no fan at all. I shouldn't say working. There was no fan in the bathroom or a window or anything to let the moisture out of that room. But there was also a suspended ceiling with a lot of brown stain on it.
Hot water was way too hot.
Yeah, we tested the hot water, and it was over 160 right away, in an instant. The carpet wasn't fastened to the floor. It was really yucky underneath. The glue was done being glue, and we asked them if they had a plan for a fire escape. I said, if there was a fire and you felt your door and it was hot, how would you get yourself and your children out of this apartment? They were baffled. They didn't know. And I said, you've got these half windows. You could lift your kids up there and then get pulled out. And they go, it was 2 women, and they're like, no, there's spiders in the window.
Okay, spiders versus fire.
But they were definitely afraid of the spiders. Yeah.
And so we gave them a cleaning kit, and we talked about the different things that they could do, but we were definitely concerned about this family when we left. And so I went to their public health nurse, and we talked about what was there. And then she called City of Howard Lake, and talked to the administrator there, and they actually had a housing code and rental housing code, and they were extremely excited that someone had called, because as their code reads, they can only inspect the outside of a building, but if they get a professional complaint, then they can go into the building for an inspection. So Chastity and I met the administrator, his assistant, and the guy that owns Minnesota, the building inspector, you know, that gives like people that are building new houses, permits and stuff. So the code guy was there. And he found that their thermostat did nothing, like it,
They had no air or anything for like
Aesthetics only.
all
It probably wasn't even
summer.
wired.
there was no fan, there was nothing. Yeah, it was like a decoration on the wall.
Oh, man.
They didn't have CO2 detector, but their smoke detector was not working.
It was there but not hooked up.
Like, and we gave them one of those. There were bare wires sticking out of the wall, like where a light fixture had been, but there was nothing there. The guy from the administrator at Howard Lake, I took him into the bathroom, and he jumped up on the tub and he was pulling the tile down, the grid down, and pushing the tile up and looking up there, and he said that the real ceiling was all mold. And then he said to me, "Do you see the brown stain up there on the ceiling tile?" And I said, "Yes." And he goes, "What's under it?" And I said, "Well, her toilet." And he said, "That's the upstairs toilet that made that."
Ooh.
They told us that this was a person who had 4 multi-housing units in the Howard Lake area. And they told us that their steps now were to send a fix-it letter to the man, and they found things wrong on the outside too, including that the garbage wasn't being picked
The
up.
dumpster was overflowing. Gas cans sitting out behind the apartment building.
So anyway, the landlord was invited to that inspection, but he did not come. And so he was given this notice of having to get things fixed. And I happened to see this article about the complaint, and it prompts them, what is the headline?
Howard Lake rental inspection could lead to new ordinance.
So they want to make it,
Wow.
they want to make their ordinance so they don't need a report from us in order to get in. But now that I know this, I think it'd be wonderful to have a partnership with these cities
Oh, yeah.
that if they want to let me, you know, if they want to refer somebody and I get in there, then I can be that person to tell them they need to go look.
So
Sounds
Board,
like
as
an
part of
excellent
this
idea.
article, it says, it was found that the entire building is most likely not habitable under current conditions. And goes on to say that the instance will bring forth more pressure to establish a new rental ordinance for the city. So again, our Healthy Homes program, I think, is, again, not a budgeted item, but something that we're doing, or something that we're doing for the community that can kind of bring awareness, which is kind of what public health does, is bring awareness to issues so they could be rectified.
And the thing that I said to the woman, I said, you know, I know that you want a new place to live. With these homes, I do find other times when they can't fix what their problem is. And, you know, to do the procedure of putting your rent into an escrow account until the landlord fixes stuff, which is the only legal way, they can't afford it. They can't get that account set up. And we don't have housing for them to like switch their housing to a different place because we don't have a lot of extra housing here.
Oh,
You said they had they had a total of 4.
He owns 4 apartment buildings total in Howard Lake.
Are the other ones that bad, or?
Not as bad, but they said the one, they would like to get inside that one also to see what it's like on the inside.
But anyway, I told the woman, even if this doesn't help you immediately, this will help many other people.
Wow.
Madam
Boy,
Chair,
thank you for your work.
Madam Chair, so does this kind of fit under health promotion or not so much, more environmental health? I mean, because this is definitely, I know you go to problem properties or when you get reports and that kind of thing, so I was kind of curious how that sort of fit in with,
Well,
when you
this-
find out that, a hoarder house or something like that.
This is more like a home visiting level.
Okay.
Because public health nuisances have to affect the people on the outside, and this just affects the people in the inside.
Okay.
Wow.
Yeah, I would say, I don't know if you know the 7 principles off the top of your head, Patty.
They're right here.
Oh, okay. Oh, they're on here. Good. So many of these complaints, like we get people complain about mold, and some of it's the actions that they might be doing. So, and not always is it landlord tenant. It could be someone in their own home, but they don't really, it's an older home, right? Or they don't.
They're smoking and.
Yeah, all sorts of different
They
things.
they don't run their fan, they're not cleaning up after a shower.
And so part of it is that health promotion where we're just providing some education about how you make your environment more conducive. And even when we work with folks who have, for instance, a mental health issue, we all know how much our environment impacts how we feel, right? So if your house is cluttered and you don't know what to do, they can kind of go through, here's a start, here's a vacuum, here's some things you can do to make your environment feel better, and you might help with your mental health.
And this
Problems as
renter,
well.
when we did come back, had cleaned.
Yeah.
Like
all
there
the
were no
spider webs were
spiders
gone.
anymore.
The house was nice and clean, so
Nice.
she definitely used the cleaning kit. That was
Yeah.
nice.
Good.
And your housing affects your long-term health. So it's also something of a health equity issue to be living in a house that's not healthy when there isn't a choice.
But it's giving people the tools so that they can take control of what they can too. So.
Yeah, sometimes people just need that extra boost,
Yes.
Somebody coming in and, hey, let's take care of this problem, so thank you.
Yeah, even simple things like leaving your pet food dish full overnight. Don't want to do that because then you're giving mice and other pests food.
Thank you.
Thank you very much.
And Board, I wanted to point out as well, the little brochure that you got, this is a effort that Health and Human Services has been doing this past year, kind of spearheaded by Lisa Spencer, our business manager, is to create more of the rack cards as we went into our new lobbies. So we have a lot of those rack cards for our different programs. So I think it's been a good introduction, and so when people do come to our lobby, and they're also easier to mail out, in the instances that we need to do that. So we have developed across financial services, public health, and social services, a number of those rack cards for information, quick information for customers.
Great.
So thank you.
And then, thank you very much for that. And information, next is the information on the September 28th meeting of the Health and Human Services Advisory Committee meeting minutes. And this was Kimberly Johnson.
Good afternoon. I had the
Yes.
pleasure of hosting the HSAC meeting on the 28th. Commissioner Hewson was there. I think that you have the minutes in front of you. I would just like to say that it was very nice to see that we have a virtual option now so that we have really good attendance, which is a great thing. There were a couple of updates. Carl Haryu gave a mental health task force update, which was very good. One thing that he did note was that Love Inc. was expressing some financial concerns, and so we did refer them to the ARPA committee for those that option to apply there if they fit those parameters. The Public Health Task Force, I think that Sarah actually gave the update for that. I thought that was very interesting. I was gone when the dental clinic kicked off, so I was sad to have missed that, but really amazed to hear that at the time of the opening, there had already been 200 appointments scheduled, and there are already more than 600 scheduled out now. So wow, shows an incredible need. I actually heard this morning, kind of a side note, that people are here in the morning before we even open, waiting to get in there. So they must open a little earlier than us, and they have had some difficulty getting dental hygienists, so they're open to that. They haven't filled all of those positions, but they have filled all of the positions for the dentists. Becky Graham attended the meeting and talked about the Opioid Settlement Advisory Council. I'm sure you all know that we're getting opioid money over the next number of years, and the Opioid Settlement Advisory Committee or Advisory Council is how they're going to decide how that money gets divided. So that will be interesting in time to come. They're going to use an RFP process, so we'll get to see what becomes of that. Then I gave an American Rescue Plan update. I briefly gave a quick little story that I thought was very interesting. I got a application for ARPA funding for someone who had a COVID component to an emergency eviction situation. And it wasn't, but I don't know, 3, 4, 5 months later, I noticed a county burial come in for that person. So they had approved ARPA funds, and that approval led to avoidance of that eviction so that this person was able to die in her own home, which is a very sad situation, but kind of moving in the sense that how terrible to be that ill and face eviction. And so that was great that
That was a touching story.
yeah, that Wright County was able to do that for her. And then Commissioner Hewson was there, and she talked about there are some ongoing fund approvals toward administrative costs on a regular basis, and the sheriff's office has made a request for radios, which is going to be reviewed.
And actually, it was approved, so.
Wonderful, wonderful.
Yeah, for the radios.
That's a very easy process for us. So what was developed, I think it took a little bit of effort in the beginning, has turned out to be a very easy process for us. And then we discussed homelessness and the prevalence in the metro versus Wright County. And I think that it is a very difficult conversation every time we have the homelessness conversation. And I talked to Sarah before the meeting. I'm like, oh my goodness, I think they want me to solve homelessness before I come back to the next meeting. And Sarah said, one bite at a time, Kim. So we're working on that. So does anybody have any questions about the HSAC meeting?
Thank you.
Okay.
Thank you so much.
Thank you, Kim.
And now on to the administration with the director's comments.
Yes,
Up,
because,
Jamie.
thank you. And actually, I'm going to invite Jill to the podium. We have kind of one not so great thing and then two good things. So Jill gets to do the not so great thing. She wants to give you an update on our, as you know, our always continuing saga of mid-choice assessments and where we stand with that. So, Jill.
So you get the dirty job.
I guess so. Hopefully I'm delivering not as fun news with a smile, right? It's the best you can do. We're doing everything we can to stay in front of demand choices, heightening demand that we continue to see day after day. But we wanted to keep the board abreast of, we are now about 100 people on the waiting list, and they're waiting about 7 to 8 weeks. So about 2 months before they actually get an assessment. And we are still throwing everything we have at it. We actually just recently came to personnel, and you guys can approve through the consent agenda. We moved one of our part-time public health nurses to a full-time status. That way we are leveraging a vacant part-time position that we had. We are continuing to approve over overtime and comp as we can, trying to balance that with a work-life balance for our staff, knowing that this is going to be an ongoing issue. Something else we just recently are started to look at is we are going to be leveraging more of, actually Kim, Jamie and I all sat down together. We're going to hopefully be leveraging some of our financial assistance case aid time to be working with our folks that are on the waiting list currently to try to get them moving on MA while they're waiting, to try to kind of tackle two of the pieces at one time to hopefully move their process forward faster. So when we do get to them for a min-choices assessment, their MA is already set up and ready to go. So we just wanted to give you the update that we're still on an up-road hill, but we're aware of it. We're trying to throw everything we can to be as creative as possible to meet these folks' needs.
And we have met with Clay and, by extension HR, just looking at some other opportunities within leveraging our staff, what we can do. But we're kind of at, I would call it a crisis point.
So in this uptick of caseloads, what percentage of it is mental health versus physical health? Can you delineate that?
I think that would be a hard one to say. It's
Okay.
kind of across
Some of them are
the
a
board.
combo platter too.
I would say and I'm kind of going out on a limb here, so, this is, but this thing anecdotally, if there are mental health issues, they're usually in conjunction with a physical health situation, which would then require, the assistance.
Yeah.
Okay.
I guess, and it's-
And, right, so I think I'm sure we'll be back talking about this. This is one of those, but I think as commissioners, you might be hearing from people because we are not within the 20-day threshold of having people heard. But I think the good news, again, about bringing in our integrated services and financial services to a bigger extent at this point is that, right now it's like, hurry up and wait, we get the referral, and then, before we can get an assessor out there, then if an assessor gets out there, then we have to wait to see if they're going to be approved for MA. So if we can do some of that legwork and kind of prime the pump a little bit earlier in the process, hopefully it'll kind of get us to a better place. It doesn't help us with the number of referrals, or the work stays the same. This is kind of the order of the work.
So are all of the referrals coming from a medical provider, or is some of them coming from?
Across the
I think a lot of them, and unfortunately, I think it's just, and I think I mentioned this at an earlier human services meeting, but I think a lot of times it's like people caring for their elderly parents or their adult children who they always thought, well, we can take care of things, until it gets to the point you can't. So instead of thinking about it months ahead, or, what's going to happen with mom or dad, as they age, it's like kind of they come to us at the crisis point when we need to do something right now. And then it's like, we even if we triage it, we often can't get someone out there for 2 months at this point. So I don't know, some of our messaging might be, even though it would bring in more referrals, that we need to hear from people sooner. So by the time the crisis hits in the family, we have a better solution for them.
And the only other thing to share is just that Jamie and I have been chatting with Clay, and I have typed up a plan A through D options, some of them actually being budget neutral, that we want to continue to have those conversations. So I think our message today is this is kind of our status, but it is something that we're keeping a close eye on.
So Madam Chair, on the mid-choice assessments, our vast majority of them are the ones that are basically at or near asset depletion. Is that they're in need of, assessing what level of funding and cares into it?
Well, most of it is actually looking at their level of need as well. It's trying to keep people out of hospital settings, out of nursing home settings, trying to keep people that they can afford to stay at home and have their needs met at home or in a more community type setting.
So scenario, if you have somebody, you go through, you do your min-choice assessment, and you find out through that their assets were still there, they still had some assets left, they haven't depleted them all out, do you have to do the assessment again?
If they don't qualify for MA long-term care, then they will be denied and they'll have to come back through.
See, and that's where the problem is, because I think a lot of times some of these older people, their assets are so, they don't know where they are, and it takes months, and sometimes you did the assessment, but nope, now you actually got 60 days more worth of funds, and if we can somehow figure out a way to maybe get some of our eligibility people to do the pre-vetting on the finance side, so that way when we actually do the assessment is good. Because the last thing was with the short resources to be able to have them doing the assessment more than once in a 90-day period of time.
Especially when these people are in crisis at the time, they're really struggle to follow through. So that's a perfect segue to where we're talking about the case aides getting involved now. We're trying to do exactly what you were explaining, that we're trying to connect with the family, see what we can do to help them with the financial paperwork process as early as we possibly can. So hopefully they're getting approved for MA at the same time they're getting their mid-choices assessment done, and then we can keep them moving forward.
And before we can really, I would say, make that systematic, we need to get through this 100 people that are already out there. So we're thinking, let's chunk off 50 of them, and you're right. And this one of the points I brought up with Jill and with Kim, it's like through attrition, maybe not a third, but maybe a quarter of them would fall off the list because we identify that they're not going to be eligible for medical assistance. And I think a lot of times, we do get a lot of referrals from kids or concerned relatives, and they might think mom or dad doesn't have any money, or they might think they have a lot of money, and it's not always the case when you start looking at it.
Well, and the harder thing is too is a lot of them are, when dealing with their grandparents, they have funds in different areas that they don't know about, and they don't even know. There's really no good way to look for this money, this life insurance policy from this agency that they hadn't gotten a statement from for eons. But it'll eventually turn up, and that's.
And our processes are confusing. We speak a lot of jargon and a lot of lingo that makes sense to us, but it doesn't make sense to the layperson. So somebody might say, I have this much money in these accounts, and then they send it in, and the financial worker looks at it and says, oh, there's this over here that you didn't share with me. Now we need to go back and get that verification. And they didn't know to not tell us.
Steven, this is the part that gets tricky, because if your eligibility, because most of them from the people that I've talked to, if you know where it's at, tell me, because I don't, they're not trying, most of them are not, probably some are trying to.
Most aren't.
They're just like, I didn't know that. Yeah. So why didn't you just tell me? Give me a list of what they have for assets, and great, Instead, it's like, we'll turn it all into you, but you're going to say, no, you're missing one.
Yeah. Start over.
Well, and unfortunately, right now, whether you're going to end up not eligible for MA, we have such a hard time with finding PCA services and things like that. So it's, it's difficult any way you look at it.
Oh, yeah.
Well, thank you for your time, and
Thank you, Jill.
hopefully next time I'm up here, we'll have a better update.
Yeah, and Madam Chair, I guess we all should have lists of everything that,
Well,
whatever your insurance policies and whatever your accounts are. and that kind of
exactly.
thing,
And my experience with my husband, when he shattered his upper right arm, he was in the nursing home for rehab. And his roommate was under the same problems, waiting so he could go into assisted living, but the paperwork wasn't all done, and they had told him that it would be at least another month before that would all be ready to go.
Yeah, nothing happens fast. And, as much as we, I think, want to be proactive and get, upstream a little bit, we're going to try out this new way of doing it, and I'm sure we're going to find some barriers, but hopefully we can find that sweet spot of
Some
getting some
streamlining.
folks, and if some folks maybe rise to the top and we can determine them MA, then maybe, they're going to get an assessment faster, and hopefully then the social worker won't be spending so much of that 8 or 9 hour assessment time talking about how you get approved for medical assistance, and all those kinds of things. Because as you know, and I worked with 2 sets of my grandparents, both, through this when they were eligible and then weren't eligible, and, all kinds of things. So it can be very messy.
This guy's children were trying to do all this stuff, and they didn't know what they were doing. I mean, no knowledge of what was going on.
So I'm going to offer up Kim's folks, and I'm going to be talking a little bit about Financial Worker and Case Aid Day, but I would, always suggest that people can call our office to get information about what it means, and get some direction. There's not going to maybe be quick answers because we can only say what would happen in certain situations, and usually we don't have all the information right at the time. But yeah, we would welcome questions from families that we can help them on the path. So board, I do have 2, I believe, really good things up here. And first of all, I would like to invite Sherry Muehlbauer to join me at the podium. She's been waiting back there, so patiently. This is kind of a big deal. I'll just warn you ahead of time. So Sherry is one of our are you hearing officer, right?
Yep.
Is one of our hearing officers in our child support area. She reports to Karen Popkin sitting back here, a very proud Karen Popkin as well. So board, Sherry was nominated for the and won the Outstanding Individual Achievement Award in 2022 from the Minnesota Support and Recovery Council, MFSRC. So basically, she's the top of the top CSOs in the state. And I would throw in there attorneys and everybody else. And the nomination was made by a coworker, Georgina Turner, along with Karen Wolf from our county attorney's office. Yeah, so
Congratulations.
it's huge. So yeah, I don't have
awesome.
Unfortunately, the conference where it was not, where she was awarded it was virtual. Maybe she liked it that way versus going in front of like 300 people. So I don't have what her nomination says, but I'm just going to read you what the award recognizes. So the award recognizes an individual who has created or demonstrated significant improvement in the mission of the child support, welfare fraud, or collections program, participated in the establishment, coordination, and implementation of recent innovations developed to enhance these programs, developed and participated in programs designed to increase public awareness and/or promote positive publicity toward the programs. This individual has received the endorsement of supervisors, directors, or state staff for whom they have worked with and has earned the respect of coworkers for their achievement. This award is given regardless of MFSRC's membership status. So kind of a big deal, and we're very, very proud of Sherry and what she's accomplished in her years here as a CSO.
Yeah, wow.
Thank you.
Oh, thank you.
And so both Kim and I sit on the MFSRC board. Kim's still here. So yes, there's a lot of I would say, really high caliber, great people. So to be at the top of what I would consider the top is really good. So congratulations, Sherry. We're very
Yes,
Thank you.
congratulations. Now, just because you got this award, don't slack off.
That's what I was afraid of too.
I don't think she will.
Thank you, Sherry.
Thanks again.
I don't have a proclamation to bring before you because we have not received one from the state, but I've been informed that October 13th is our County and Tribal Financial Worker and Case Aid Day. So we were just talking about the difficult work of financial workers. We call them eligibility specialists. I have a little bit of language from an earlier proclamation. County and tribal financial workers and case aides are dedicated to providing outstanding service to the people of Minnesota through their administrative public assistance programs. And county and tribal financial workers and case aides are responsible for the prudent expenditure of millions of dollars annually and must meet high standards of job performance in determining eligibility for public assistance. And it's important to recognize the valuable services county and tribal financial workers and case aides provide for Minnesotans by delivering culturally responsive case management and accessible community services with a person-centered focus. And I think when we're talking about our elderly, our disabled people that just basically don't have a lot of money, they are really in a tough spot working with people, again, intersecting with us at a very difficult time of their life. So I think our eligibility workers and our case aides do a phenomenal job here in Wright County. So October 13th, we're going to be having 12th, and then is that Wednesday? And on Wednesday at 8:30, I think, up on our second floor break room, we'll be having a little hello and hooray for them. So you're certainly welcome to join us.
Nice.
Thank you.
Thank you. And that's all I have, unless anybody has anything else.
Well, I'd like to also say that October is Breast Cancer Month, and I would suggest that ladies and gentlemen, that this affects both of you, and please don't forget your mammograms and your self-checks.
Well, not only have you recognized that, we'll capture it in our minutes as well. So thank you, Commissioner.
Yeah, thank you.
Thank you.
Well, is there anything else anybody wants to add? Otherwise, I guess I will call this to end.
Thanks, everybody.